My name is Mark Davis. I'm Professor of Operations Management at Bentley. Okay. And last May, I had the opportunity to attend a conference in Boston, Paul Revere Hotel, and John was a speaker, and he really impressed me, and to the point where I said, we got to have him come to Bentley and talk to the students. Yeah, for those of you who know me, I'm a customer-focused management service operations person, and it's all about the customer. And whether we call them patients or passengers or guests, they're all customers. And since about 2010, we're in what they call the age of the customer, and the customer has the power in the marketplace today. So John's going to talk about the healthcare consumer revolution and its impact on the patient experience. So we talk about experiences, customer experiences. John, I should say, is it Dr. Burroughs or John?
John.
Okay. John is president and CEO of the Burroughs Healthcare Consulting Network and works with some of the nation's top healthcare consulting organizations to provide best practice solutions and training to healthcare organizations throughout the country. John has an MD from Case Western Reserve University in Cleveland, and he has an MBA from UMass Amherst, an MBA with honors. And the last point I want to make out is this presentation has been sponsored by the Healthcare Thought Leadership Network. And I want to thank Danielle Hardigan for coordinating. I got John, she did all the work. Danielle Hardigan, Danielle Solak. So without further ado, let me introduce John.
Thank you very much. Thank you. Thank you. It's so great to see the next generation of healthcare revolutionaries, because we're at a real crossroads right now. Every 100 years, industries go through what's called a 100-year inflection, and it's where they completely get overhauled. And healthcare is in the process of getting overhauled right now for reasons you will understand. So, does anyone know why patients are now consumers? And by the way, this is group participation, so I don't go on with my talk until someone gives me an answer. So who knows why patients are now consumers? If you're smart, you'll read the slide. Yes? Excuse me? Private hospitals? That's not the reason why they're consumers. By the way, I'm going to be moving around, just so you're aware. Okay. So why are patients now consumers? Doctors really don't like calling them consumers. Yes? They're paying a lot of money. What's happened is most health insurance comes from private employers. You get health insurance by your place of employment, or as you get older like me, you get it from the government. But what's happening is everyone's putting more and more risk onto the person, which means you're going to be paying more and more cash out of your pocket. And if you're paying cash, what are two things that consumers want to know? When you go to buy anything at a store, what do you want to know? You want to know what it costs, exactly right. And if you go to a hospital now, what will they tell you if you ask what it costs? They'll say, I don't know, it's a surprise. And when you're all done with your care, we'll give you the big surprise. Could you imagine going on a cruise and having the cruise operator tell you, I have no idea what this cruise costs, but when we're done with the cruise, it'll be a big surprise when you get off the boat. What else does a consumer want to know? I saw another hand. What else do you want to know besides what it costs? Come on. Some of you are professional shoppers. Service, yes, but what do you want to know? If you're buying a lovely outfit, what do you want to know about that outfit? Quality. How well is it made? So you want to know not only what it costs, but what you're going to get. And how many of you look up, when you go to a doctor, look up their quality ratings before you go to a doctor, see if this doctor's any good? Good. Well, you should. You should. And by the way, places like Health Grades, Doctors Compare, Hospitals Compare, ProPublica, Leapfrog. You can go online and find out how good is the doctor who's going to take care of you. And if the doctor's not rated, don't go to them, because good doctors are proud to share their quality data with you. Very good. So there's what's called high deductible policies, which means you pay more and more out of pocket in cash. And most employers require their employees to have what's called the health savings account. And that's an account you can roll over every year tax-free, and a little pile of money builds up over the years, and they expect you to pay for your own health care. Now, here's another reason why Americans are becoming consumers. They're being squeezed out of the market. And let me give you an example. How many of you have ever heard of the term, this is a business term, days cash on hand? Days cash on hand is a business term that means if I stopped your paycheck, how long could you pay your debts or liabilities until you'd be broke? And hospitals like to be at least 200 days cash on hand. That means they can go 200 days without getting a single penny of revenue until they run out of money. Does anyone know what the average days cash on hand is for the average American family? Just anyone take a guess. 30, not that little, but it's about 90 days, which means a middle-class American family, if you stop their paycheck tomorrow, 3 months from now, including their mortgage and life savings, they would be bankrupt. And does anyone know what disease can bankrupt an American family faster than any other? Yes? I'm sorry? No, not that one, but yes? Cancer is absolutely right. I'm sorry, did you say that? I apologize. I had my hearing aids in, but obviously they weren't good enough. You're absolutely right. Both of you are right. Cancer, good for you. Because someone with cancer can spend up to $50,000 to $100,000 a year out of pocket for the drugs. And by the way, the same drugs that overseas cost 90% less. And I hope those of you who are going to grow up into healthcare, I hope you will stick it to the pharmaceutical industry so we get charged the same prices that they're charged everywhere else in the world. Because we pay almost double and triple everywhere else in the world. And cancer can bankrupt a family faster than anything I know because you'll have to pay $50,000 to $100,000 out of pocket. So some organizations are starting to do things like Oklahoma Surgery Center in Oklahoma City, Oklahoma are starting to publish their prices. Some people are trying to give 24/7 access. And people want market-driven responses. Any of you know the difference between marketing and sales? Hint, they're opposites. Who has studied marketing and sales? Anyone here? Did you raise your hand or? Well, selling is saying, I have good stuff. I want to make money, and I want you to have more of my stuff.
And marketing is finding people and showing them that they need that stuff.
Well, that's selling. We call it marketing, but it's really a form of sales. What is marketing? I'll give you a hint. Entrepreneurs market in order to make money. What is, yes? What they're doing is they're discovering value by asking people, what don't you have that you need that I can make for you? And the aphorism is, if you market real well, you never have to sell again. And what we're starting to see in healthcare is people are saying, what do you need that you don't get? For instance, where do you go for healthcare at 2 o'clock in the morning on Sunday morning if you can't afford an emergency room? And the answer is most people don't know where to go. Now, what people want, standardized evidence-based practices, do you want a doctor who practices according to 1997 or a doctor who practices according to 2017? Well, the answer is obvious to that. But some doctors fall behind and they don't keep up. And everyone wants decent service. How many of you get great service when you go to your doctor's office or to an emergency room? I'm not seeing a lot of hands. Emergency rooms are not famous for great service. They treat you like you're lucky to be there. You're lucky to be there and pay astronomical prices for average service. So this is what's going on now. It's called medical tourism. Last year, 1.7 million Americans left the United States to get health care. Why would Americans leave the greatest country on earth to get health care abroad? Anyone? Yes? It's much cheaper. Can you guess how much cheaper it is? You're absolutely right. It's 80 to 90% less expensive. So if a family has cancer or heart disease, they have a choice. I can stay in the United States and go bankrupt, or I can go overseas and get equally or better care and be able to still afford that trip to Disneyland with my kids. So this is why medical tourism is the fastest growing industry in healthcare. It's doubling every 2 years. And those of you who wanted to get in business, think about medical tourism. And if you go to this website, Patients Beyond Borders is a company in Boston. And you go to the website, you'll see something like this. Paul's an executive who needs meniscus surgery. So there's no jargon here. Does anyone not know what a meniscus is? It's the cartilage in your knee. And athletes often will tear that cartilage, and you have to remove it so it doesn't cause arthritis. Needs meniscus surgery of the knee. Couldn't find anyone to do it for under $32,000 in Dallas. Goes to a Joint Commission International Accredited Hospital in Mexico and paid $6,200 for first-class travel, accommodations, and nursing. So what Americans are now starting to do is, if I need care and it's going to bankrupt my family, you know something? I'd rather go abroad and get it there and get it done well. And that's going on all over the country. Now, this is what large employers are doing. Large employers no longer give their employees health care. What they do is they give you a little pile of money. A little pile of money is called a defined contribution. And they expect you to take that money, put it into a health savings account, and then roll it over every year. Employers are starting to do disease management because they're suffering from both absenteeism and presenteeism among employees. Does anyone know what presenteeism is? Presenteeism actually costs American employers more than absenteeism does. Anyone know what presenteeism is? Yes? When someone, that's exactly right. Someone shows up to work, but they're too sick to do their job. And does anyone know what the top 3 causes of presenteeism in the United States are for employers? Yes? Well, overtime, yeah, but I mean, they're at work. But what illnesses, what problems are the top 3 causes of people showing up at work but not being able to do their jobs? Depression, back pain, and obesity. And obesity is now the #2 cause of premature death in the world. And by the way, obesity often kills people by getting higher incidence of cancer and heart disease and strokes, etc. We think of obesity as just an overweight problem, and it's not. Reference-based prices means that people are going to have to charge the same. Navigators are nurses who help people navigate through a system. And what every large employer does now is do what's called domestic medical tourism. Any of you ever worked at Walmart? Okay, if you ever work at Walmart as a full-time employee, they have arrangements with these 6 healthcare organizations. And if you go to one of these 6, what do you think Walmart will do for you? They'll pay for everything. They'll pay for your travel, your work, your deductible, your copay, your coinsurance, everything. You don't pay at all. If you want to stay in Boston and get it done locally, no problem, you pay for everything. So large employers are now starting to incentivize their employees to go to one of the places that they choose. And why would they choose these 6 places? What do these 6 places agree to do? Charge less and give more. In other words, they'll guarantee the quality and they'll charge much less. And by guaranteeing the quality, it means if they have a bad outcome, Walmart doesn't pay. And that's called what are called narrow networks. And large employers now are picking out doctors and hospitals that are willing to participate in narrow networks to ensure the quality of care. So this is what's happening to every industry in the world, and it's happening to healthcare. Why are all industries, including healthcare, standardizing? Anyone know why we're starting to standardize our practices in healthcare? Yes? Well, it's get insurance reimbursement, but why are doctors now starting to standardize how they do operations and take care of patients? And hospitals are starting to standardize. Yeah. Reduce mistakes is absolutely right. Mistakes due to variation is now the 3rd greatest cause of death in the United States, right behind heart disease and cancer. In other words, doctors all practicing differently can kill you, and hospitals all practicing differently. Atul Gawande, who's a surgeon who lives in Newton and works in Boston, wrote a wonderful book called The Checklist Manifesto. And he wrote a wonderful article, which you should all read, called The Bell Curve. It was published in the New Yorker in 2004. And he demonstrated that if you have cystic fibrosis, which is a life-threatening disease of small children, your life expectancy varies by as much as 30 years based on what facility you go to and which doctor you go to. So it's absolutely enormous, the variation in healthcare. So healthcare, like every other industry, is standardizing to eliminate non-value-added variation. What does commoditizing mean? Any business students here? What does commoditizing mean? I'll give you a hint. It's called the race to the bottom. And what happens is everyone's trying to find cheaper and cheaper healthcare services because people cannot afford healthcare anymore. Most people are priced out of the market. Most healthcare, like every other industry, is becoming digitized. Why is everything becoming digitized? So we can get access to it 24/7. Where do you do your banking? Where do you book your trips? Online. I'm old enough to remember, I grew up in Newton, Massachusetts, I'm old enough to remember when in order to get money out of a bank, you had to go with a bank book to a banker during banking hours and get your little book stamped by a clerk at the bank, and only then could you take out your money, or you could put money in. That sounds absurd to all of you because you didn't have to grow up with that. But right now, how do you get your health care record? You have to go to a hospital during hospital hours and fill out a bunch of forms and take your health care records out. You should be able to access your health care records 24/7, cloud-based without any problem at all. And healthcare is getting globalized, which means we're in competition with the world, and most people haven't woken up and figured that out. Now, you all know about apps. There's apps everywhere, and healthcare is some of the top apps in the world. There's over $26 billion in healthcare and fitness apps around the world. Some of you want to go into business with healthcare. I suggest that industry as well. And venture capital are all over this. Now, healthcare organizations are figuring out that if you don't have an app, you're not even in business anymore. How many of you can access your doctor or hospital through an app on your phone? Good, good. The rest of you can't. And that's crazy to me because everyone your age accesses everything through your device. In fact, I'm amazed that some of you still have computers. A lot of people your age don't even have computers anymore. You have devices and multiple devices. The average person now has 5 devices. We're in what Steve Jobs calls the post-PC world of devices, and if you're not on the device, you're not there. The best app I've ever seen is from UCLA, and you can get a tour, you can call your doctor, you can book an appointment, you can pay a bill, you can check your lab test, you can check your x-rays, check your CT scan, check to see if you're pregnant. You can do whatever you want to do on that app, and that's where the industry is going right now. And of course, the leading apps are exercise, reference, weight loss, et cetera, et cetera. Social media. How many of you use social media for healthcare? Well, Beth Israel Deaconess in Boston and UCLA Children's actually raise millions of dollars on Facebook every year, and a lot of people interact on social media like LinkedIn, Twitter, and Facebook for healthcare information now, and that's also coming down the pike. So this is what's going on around the world, and I'm going to cover each of these one at a time. So first of all, how many of you have an app that you can access healthcare in? You can access a doctor or a nurse or ask for help or get any type of guidance on your phone. How many of you have heard of American Well? They're located in Boston, Massachusetts, and they're headed up by a doctor. American Well is the #1 purveyor of e-health right now, and it's exploding. It's a multi-billion-dollar business, and you can now access a doctor on the phone, and I'll show you in just a little bit. So, come on, you can do this. I'm going to need some help with the slides. This clicker's dying on me. Oh, here we go. Okay. How many of you have wireless technology like an Apple Watch or a headband or something you can monitor blood pressure, pulse, weight, respiratory rate, mileage, et cetera, et cetera? Absolutely. And everyone's going to be able to be monitored through wireless technology without having to be hooked up to a machine, without going in for lab tests. Any of you have diabetes? You don't have to raise your hand. HIPAA. We don't want you to raise your hand. But diabetics now can have implantable devices where you can get your hemoglobin A1C and your sugar monitored automatically. You don't have to see a doctor to get a blood test or get a urine test. And it'll monitor automatically, and it will send you an alert and send your doctor alert if you have problems with your diabetes. Smart care teams. What's being built now is called a health information exchange, and it's going to be worldwide. That means you're going to be able to access healthcare information anywhere in the world, from anywhere in the world at any time. How do you access your credit card? How do you access your money in the bank? You can access it online, on your phone, etc., day or night. Well, you're going to be able to access healthcare as well. And we're not going to need as many doctors in a couple of years. Why aren't we going to need as many doctors? Anyone? Who's going to be managing healthcare in the 21st century? You are. That's right, the patient. And Eric Topol wrote a wonderful book about that called The Patient Will See You Now. When they say patient-centered care, it's not we take the patient into consideration. It's your generation's going to be managing healthcare. You're going to be hiring and firing doctors. You're going to be hiring and firing pharmacists or hospitals, etc. And if they don't meet your healthcare needs, you'll pick from one of a gazillion others. That's consumer-driven healthcare. The patient is going to be in charge. The consumer is going to be in charge, not the doctor, not the hospital, and certainly not the payer. So this is what organizations are doing now. They have what are called analytics. So who here knows the difference between data and analytics? Anyone here? Some of you must study this stuff. Any of you know what analytics are? Okay, analytics are going to take over healthcare. You have a hand half up. You say, what's the point? I saw that. What's the point? Do you know the difference between data and analytics? Analytics is real-time information. Data is all retrospective. Data is what happened last month, last year, last whenever. Analytics is what's happening right now and predicting what's going to happen in the future. So analytics can be predictive analytics. It can be concurrent, or it can be retrospective. Data is always retrospective. It's always in the past. And this is interesting. You can't read it from where you are, but this is predictive analytics coming out of the Mayo Clinic for their employee health program. And they said this was a big surprise. What happened was they fed in all this information on their employees, including what are called non-clinical indicators. Now, what do you think has an impact on whether you live or die that has nothing to do with your doctor? For those of you who study public health or population health, what has greater impact than seeing a doctor? Anyone? Social relationships. How about your mom and dad, your DNA? Do you think that has anything to do with your life expectancy? Well, it does. I always tell people, pick your parents very carefully. Has a profound impact on the rest of your life. Where you grew up, your zip code is the #1 determinant of your life expectancy. And if you don't believe me, look up hotspotting in Boston, and you'll see based on where you grow up in the Boston area, that's a predictor of how long you're likely to live. And the difference is up to 35 years, depending on what neighborhood you grow up in. Also, what healthcare decisions you make. If you decide to smoke, excessively drink, take cocaine, drive a motorcycle without a helmet, you will die earlier. I promise you, and I can show you the data to support it. You will die earlier. The more overweight you are, the shorter you will live. I can predict it for you. I'll give you an idea with smoking. Every pack a day you smoke takes 10 years off your life. So if someone smokes 3 packs a day, their average life expectancy is 45 instead of 75. You can count on that. You can take that to the bank. That's data and analytics. So this is an employee health program for Mayo Clinic, and what they found out is half of their employee costs were from ear, nose, and throat problems in kids of the employees. Now, why do you think kids of employees would they get higher than expected ear, nose, and throat infections? Anyone? Yes? Yes, but what do you think their parents are doing? Yeah, but why do you think they're getting higher than expected ear, nose, and throat problems? The kids are, but what do you think the parents are doing? How about their smoking? Parents who smoke, the kids have double, triple, quadruple the incidence of infections. Kids who go to certain daycare centers are more prone to infections. So what do you think the Mayo Clinic did? Is they gave them smoking cessation programs. Give you one more. Next group down is dermatology in kids. Why do some kids get higher than expected acne, like some of you had to go through when you were growing? Why do some kids get more acne than other kids? Junk food, sugar. Americans are addicted to sugar. And by the way, we have 5 times the incidence of diabetes that we expect in the United States because we eat sugar in everything. And if you don't believe me, look at the labels on ketchup, relish. Look at the labels on salad dressing. Everything has peanut butter. Everything we eat has sugar in it. Okay, Castlight, ZocDoc. You can go online now and find out how good a hospital is, how good a doctor is, ZocDoc, Hospital Compare, Physician Compare. Any of you ever go on Leapfrog or ProPublica or any of those websites or health grades to see how good your doctor or hospital is? You should start checking that stuff out. Oh, the iPhone will be the primary healthcare entry point. How many of you have ever gotten healthcare on your phone? Okay, the rest of you, next time you get sick, you should probably try it. It's a lot easier. And let me give you an example. One night, this is now about 8 or 10 months ago, I had a nasty rash on my wrist. I had a contact dermatitis. Now, being a doctor, I knew what I needed, but I needed a doctor, and it was 4 o'clock in the morning. So I went on my phone, I have my Amwell, my American Well app, and I tapped on it. How long do you think the waiting time was for a doctor? 2 minutes. And did I have a choice of doctors? I could choose from 36 doctors. Could I look at their backgrounds, their malpractice case, their certification? Yeah, I could check out their credentials. So I picked out a doctor, and the doctor greeted me and did an ear, nose, throat, lung, heart exam, did a full exam, looked at the rash, said it looks like a contact dermatitis. I was kind enough not to say yes, I knew before I called you what it was. But I said, thank you very much, doctor. I agree with you. She says, what's been helpful to you before? I said, 2 grams of 2% hydrocortisone have worked before for me. She said, that's great. She said, I noticed on the GPS that there's a Walgreens near your hotel, just a few blocks away. Would you like me to call the script there and have them deliver it to your room? I said, that would be terrific. 10 minutes later, a kid comes to the room with the meds, pay the kid, pay the tip, go back to bed. Anyone know how long this entire interaction took? 22 minutes. Now, is this as good as seeing a doctor in the flesh? No, but it's cheaper, it's easier, it's more convenient, and this is where healthcare is going for simple to manage problems in the 21st century. People are not going to be going to a doctor's office and sit in a waiting room and wait for a doctor for an expensive 5-minute visit. And this thing is now dead. Okay, if you wouldn't mind, slide, Turner. Next slide, please. Retail clinics. How many of you ever been to a retail clinic like CVS, Minute Clinic, or Walgreens, or Walmart, etc.? How many of you ever been to one of those? Yeah, it's very pleasant. You go in, you can make an appointment, you see a nurse practitioner, it costs $59 or a little more, and they're nice to you, and you can get everything taken care of in time. They stick in their sandbox, they see 36 high-volume, low-risk conditions, etc. Next slide, please. So retail clinics are taking the place of emergency rooms around the United States. Now, this is why retail clinics started. Now, for those of you who can read it from here, if you'll notice, the light blue is the waiting time to see all specialties, and the dark blue is the waiting time to see a family doctor. Look at Boston, Massachusetts. This is just a few years old, this data, but the waiting time to see a specialist is 45 days, and the waiting time to see a family doctor is 66 days in Boston, Massachusetts. So if you have a sick kid, how many people are willing to wait over 2 months to see your family doctor to get this taken care of? Exactly. No one's going to wait that long anymore, which is why the other people have gotten into the business, and we have all these retail clinics now. So you can, on demand, see a nurse practitioner or a doctor 24/7. Next slide, please. Okay, so this is an example. CVS has minute clinics, and minute clinics are managed and run by Andy Sussman, who's a doctor. He's a general internist, and it's big business now. And this is business, ironically, that hospitals didn't want to do. Hospitals knew that the only place you could go was an urgent care center or emergency room, both of which are expensive. So these people started doing, and they're making a lot of money doing it. Walgreens treats diabetes and hypertension. Walmart has Smart Care Doc. You can get a telemetry doctor now at Walmart. Next slide, please. So e-health, this is the big one. This is the really big one. This is changing the world. Now, there's 337 million Americans in the United States. Can anyone guess on the number of e-health visits there was in the United States in 2016? Anyone want to take a wild guess? There are 337.5 million Americans. How many visits do you think there were last year on the phone or a kiosk through e-health? Anyone want to guess? 100 million. 100 million. This is taking over the world right now. Again, this is not as good as seeing a doctor in person, but it's a lot more convenient, it's a lot cheaper, and it's a lot easier, and this is sweeping the world right now. It is sweeping the world. Next one, please. So, American Well is the largest company in the world that does this, 82% of the total worldwide market share. 100 million Americans have accessed their services across now 49 states. It's now $59 a visit, and they'll take all insurances. They'll treat you if you have a simple to manage, easy to diagnose condition. Next one. Okay, so this is what you can do on eHealth. eHealth is really remarkable. Most of it's urgent care right now, like colds, runny nose, sore throat, earache, etc. But on-demand inpatient consults. If you're in a small town that doesn't have a cardiologist or doesn't have a pediatric oncologist or doesn't have a dermatologist, you can access any specialist now online on your phone in just 2 minutes. In just 2 minutes, you can access anyone on the phone. I was working with a hospital in Beatrice, Nebraska, and they said, we are desperately trying to find a dermatologist for our hospital. And what did I do? I handed them my phone. I said, here's your dermatologist. They said, what do you mean? I said, why do you need to recruit a dermatologist to the panhandle of Nebraska when on your phone you can get somebody for $59 24/7 day or night? It makes no sense. You don't need a dermatologist anymore. If you're in an emergency room and you're backed up, you can use people who are less sick to go on their smartphone to take care of them as patients. Home health care, if you have an elderly person that can't get out of the house, you don't have to take a van and bring their wheelchair onto the van and bring them up with a lift and then take them to the doctors and bring them down on the lift and bring the wheelchair into the doctor's office. You can treat them at home with a smartphone. I had my hernia repaired 2 years ago, and I drove 20 minutes to the doctor's office. I sat in the waiting room for a half hour after my hernia was fixed. I got put into a room by a nurse. I waited 15 more minutes. The doctor came in. I said, how are you doing? Why don't you cough? I went, and that was the end of the visit. I could have done that at home. I did not need to come to the doctor's office to cough for him after my surgery. That could have been done on the phone at home. So post-discharge surgical care, and plenty of people suffer from behavioral issues, and you don't have to go travel someplace to see a psychiatrist or psychologist. You can do it right on a phone. So e-health is changing the world. Next slide, please. Okay, so what do patients and consumers want in the 21st century? Transparent. Is it fair to say, I want to know what it costs before I get the service? Is it fair to say, can I be assured of good quality? And let me tell you 2 stories. I told you I got my hernia fixed in North Conway, New Hampshire. And I happen to know the doctor very well, a very good surgeon named Victor Lazarin. And I said, Victor, how are you going to do my hernia? It was a nasty hernia. I won't get into detail. You may have had dinner already. And I said, Victor, how are you going to do the hernia? He said, I think I'll do it laparoscopically. It's a lot slicker. It's, I can do it without having to open you up so much, and I can manipulate. You won't spend as much time recovering. It won't hurt as much. It's really great. I said, Victor, let me explain something to you. I said, I'm paying $5,000 out of a $5,000 deductible for this procedure. And I took out my credit card, and I said, I'm going to put it on this card. And if I have a recurrence through no fault of my own, I'm going to call the credit card company and cancel the charges. So how would you like to do my hernia? He said, I think I'll do it open. Well, in medical speak, that means she's going to make a much larger incision. It's going to take a longer time to heal, and it's going to cause me more pain. I said, that's great. I said, because after you're done with the surgery, I never want to have to see you again, with due respect. I'll tell you one more story. There was a family whose dad had a procedure in the North Shore. I'm not going to tell you which hospital. And the surgeon inadvertently severed his tibial artery and nerve in his left ankle, which means he walked with a limp for the rest of his life. And the family went to the doctor and said, "Doctor, I hope you're not planning on sending us a bill." And then they went to the hospital and said, "Hospital, I hope you're not planning on sending us a bill. And we'd like you to sign this contract, which our lawyer has prepared, stating that you're prepared to take care of Dad's ankle for the rest of his life. Because after all, this happened on your watch." Welcome to the new consumerism in healthcare. People aren't going to tolerate unnecessary bad outcomes. They're not going to tolerate it anymore, and they're not going to pay for it anymore either. They're not going to pay for it anymore. People want timely service. Timely service. They want control of their own healthcare information 24/7. You should demand that. They want evidence-based care, which means they want the latest care. They don't want care from 20, 30, 40 years ago. And finally, they want to control their own healthcare. They don't want the doctor controlling it. They don't want the hospital controlling it. They don't want other people controlling their lives. People want control now of their own healthcare. So I'm going to leave you, that actually worked. I guess it came back to life. I'm going to leave you with 3 quotes which I really like. One of them, if the rate of change on the outside is greater than the rate of change on the inside, the end is near. Jack Welch is the former CEO of General Electric, and he was asked when he retired as CEO, "Do you have any regrets as CEO?" He said, "Yeah, I do." He said, "I would have done everything faster." He said, "I would have fired bad employees faster. I would have done new initiatives faster. I would have embraced new strategies faster." He said, "I was too cautious." He said, "If I had to do it all over again, I would have done everything twice as fast." Number 2, I love this quote by Lao Tzu: "If you do not change direction, you may end up where you were heading." Now, where we're heading right now is a bad place in healthcare. We're bankrupting the country. We have this thing called fee-for-service, where doctors get richly rewarded for doing procedures and tests, and hospitals get even more richly rewarded for doing procedures and tests, and that's not good for healthcare. And I like this one: "Our only security is our ability to change." So since many of you will be going into healthcare, I strongly urge you, embrace the new healthcare revolution, embrace the consumer revolution, and be an advocate for change, and you will be far more likely to succeed. Any questions? Any questions? Yes, sir.
I was just curious, how much of these changes that you've observed are unique to the United States compared with other nations? I'm just trying to figure out if you think these are driven by the type of healthcare system that we have in this country, or if these changes are global, even places like Canada, they're seeing the same trends towards consumers.
This is going on worldwide. When I said that every industry is going through standardization, commoditization, digitization, and globalization, this is going on worldwide. There are countries out there who never went through the initial computer era because they were poor countries at the time, that are now all have smartphones. What's interesting is that smartphones are so much cheaper than a computer, and they're so much easier than a computer to manage, that many countries that never went through the laptop or the personal computer are going straight to the device. So what I'm seeing from my reading all around the world is that this is happening right now. E-health is sweeping the world now, including developing nations. And frankly, it should, because it's cheaper and it's easier. And there are a lot of nations that can't afford to go to a hospital like Brigham and Women's and see a specialist who charges $600 an hour. They can't afford that, but they can afford $59 on a phone to speak to the same level specialist. So this is actually sweeping the world, because I'll give you another example. I spoke to a doctor a couple months ago in Bangalore, India, and he said he's building a heart hospital so he can do in Bangalore what the Cleveland Clinic does for $125,000. He's going to do open heart bypass surgeries for $9,000. And he said his goal is to put the Cleveland Clinic out of business. And this movement to race to the bottom, to get cheaper health care that's better, easier, more accessible, this is a revolution going on in the world, and it will enable people in much poorer countries to be able to access healthcare services at all. Because this type of healthcare is 95% cheaper than seeing a doctor in a building.
So in universal healthcare systems, there's still that movement towards consumerism?
Yes, yes. And if you look at every other industry, and by the way, healthcare is an industry like every other industry. Who controls banking now? Do you have to go to a teller or a banker during banking hours anymore? No, you get 24/7 access. Who books your airline flights? Do you have to wait for a travel agent to be open? I'm old enough to remember when I had to buy my tickets through a travel agent, and if I lost my ticket, I couldn't get on the plane. Anyone remember that? And so every other industry's already gone there. Healthcare is another industry. And so we're going the same way that all the other industries are going. It's just because it's so complex, we're the last industry to get there. But it's going to get there because people want cheaper, easier, more convenient, cloud-based, 24/7 access, the services they want when they want it. Everybody wants that now, and that's why it's going there. Any other questions? Yes, Smith. Well, that's a great question. And I asked that same question of the CEO of American Well, downtown Boston. By the way, their headquarters is on Boylston Street. And if you ask the CEO, and he's a doctor, he said, we have strict protocols that everyone has to follow. It doesn't matter how many years they've been a doctor. They have strict protocols. And if I come to you with a fever and a rash instead of just a rash, they won't touch me. But they have 36 conditions, and only 36 conditions they'll treat, and they follow evidence-based standardized protocols for every single thing. And if I don't get better, they'll never try to take care of me a second time. They'll immediately refer me to a doctor. So they follow strict protocols, strict algorithms, and they'll only take care of certain conditions. And if I come in with chest pain, abdominal pain, back pain, they'll say, no, you need to see a doctor in person. But on the other hand, if I have a runny nose or pink eye, or I have a sore throat or an earache, that they'll be willing to treat. So the key is standardization, is standardizing the approach. I saw a hand over here. Let me go over there. Oh, the same question as hers, absolutely. What needs to be eliminated in healthcare is what's called non-value-added variation. Healthcare up until 1999 was a cottage industry, which means every doctor could practice the way that every doctor wanted to practice. And what we now know is that that actually kills over 500,000 Americans every year, because there's a wide bell curve, as Atul Gawande wrote in The Bell Curve, from good care to average care to terrible care. And he showed that the life expectancy for a child with cystic fibrosis went anywhere from 20 years of age to 50 years of age, based on the hospital you go to and the doctor you see. So what eHealth is trying to do is to eliminate what's called non-value-added variation, which means variation by doctors that actually harms human beings. The problem with the old system is that we celebrated that every doctor practiced a little differently, and that was respected and honored. Now we know it's very dangerous. You have another one?
As you said, we care about the cost and quality.
Yes.
So what about the quality of the diagnostics through the smartphone or the digital diagnostics?
I was cynical about that as well. She asked, how do you assure quality over the smartphone as well? Ironically, most of these visits get recorded with your permission. And what's interesting to me as a doctor, I was really snotty about this. And I went to American Well and said, you can't do an ear exam and a nose exam and a throat exam and a lung and heart exam as well as I could do it as a doctor. I had a fancy Lippmann stethoscope, and I had an otoscope and a laryngoscope, and I got a much better exam. I looked at their exam. With their technology now, with their laser technology and their able to digitalize image, you can see the ears, the nose, the throat much clearer than I ever could doing it by hand. So the technology is enabling people to do things in different ways. And I'll tell you another story. I saw surgery on a child for an appendectomy in a hospital that didn't have a surgeon by a robot from a doctor who was in Detroit. He was operating the robot from Detroit, yes, and doing an appendectomy on a child in a remote rural area. So technology is now enabling us to do things we could never do before at a very, very high level of quality, which frankly 20 years ago could not be done. Yes. Let me come over so I can hear you.
Is there any legislation which prevents certain diseases to be
Well, ironically, regulators and legislators get dragged behind innovation. And what happens is new inventions are made that sweep the world, and then one day politicians wake up and regulators wake up and lawyers wake up and say, wait a minute, we don't have any rules around this stuff. And so that stuff always lags from behind. So they're just beginning to create real rules around telehealth and telemedicine now. And every state except for 2 enables telehealth and enables doctors to bill for that service now. But you're absolutely right. There's always a lag because there are unanticipated consequences that you can't anticipate when you start using something.
So the examples that you showed, like there's a doctor at the end. So the doctor really is doing it remotely through the smartphone.
Yes.
But suppose like now you have the AI revolution, right? So suppose if you don't have a doctor, a human being, like if you had something like automated, like suppose like an AI, would it be possible? Like would legislation prevent that?
He's asked a very profound question. He's asking the question about big data, which is artificial intelligence, like a Watson, et cetera. And by the way, doctors at some of the nation's top facilities are learning how to use Watson to optimize. Now, I will tell you, the human mind alone is inferior to Watson, but Watson is inferior to not adding the human mind. Because what humans can do is the fine judgment and the fine nuanced perceptions, et cetera, et cetera. What Watson does better than anyone else is collate billions of pieces of information at a level of complexity that the human brain can't handle. What we can do is we can synthesize objective and subjective information and emotional information and even perceptive auras of information together in a way that the computer hasn't learned how to do yet. So I'm predicting that we're going to use artificial intelligence and big data coupled with the human mind and the human soul. Now, for easy to manage things, I agree with you. I think Watson will be able to handle it alone. If I have pure pink eye, or I have pure ear infection, or I have pure throat infection, I think Watson can do a fine job. And I think what you're going to see is more artificial intelligence-guided diagnoses in the future. That being said, medicine and healthcare is a very human endeavor. And all the emotions and the spirituality and all the human aspects of healthcare, I think, is so intuitive and complex that even Watson will need the human soul coupled with its wonderful ability to really get an optimum outcome. But that's a very good question.
We have maybe time for one more question.
Any other questions?
Last one.
Going once?
Going twice.
Twice?
So,
Yes. Oh, we have one more. We have one more.
So why would doctors volunteer to do these services when they're making less money over like the phone, when it's still done in the traditional manner, or they might make more money doing it at a doctor's office?
Well, good question. And people like me who are consultants are actually going around the country helping doctors to make more money by being an executive clinician rather than a piece worker. And I could spend a whole hour talking about that, but traditionally doctors made money by seeing one patient at a time, almost like a factory. You know, they'd be in an office and a patient would come in and they'd see the patient and charge the patient, see the next patient, charge the patient. I'm teaching, and people like me are teaching doctors how to see, instead of 20 people a day, how to see 200 a day. But the difference is you're going to have PAs, you're going to have advanced practice nurses, you're going to have people, things like IBM's Watson, and you're going to focus on the more complex things and let the less complex things go through e-health, nurse practitioners, and PAs. But the doctor's going to be responsible for more patients and be paid on a per member per month or capitated basis to handle much larger populations of covered lives. And that's how they're going to make big money in the 21st century. So I actually worked with a doctor in El Paso, Texas, to create a $1.3 million contract that this doctor could do by A, seeing his own patients, B, overseeing 4 nurse practitioners and nurse midwives, 3, managing a free clinic for people who couldn't afford or weren't permitted to buy insurance, and then 4, overseeing a service line with monetizable metrics. So the whole business model for physicians to earn money taking care of people is radically changing. And people like me are going around the country and helping doctors to adapt to the new business world as opposed to the old business world. Good question.
Thank you very much.
Thank you. Thank you. Thank you for having me.